Thanks, Ben. So this is the Women's Health team. It's led by myself and Kirsty Coxon, who's there in person with you today. And Abby Mariel is my deputy, and these are our sub-theme leads. We do have our public contributor champions whom we've now appointed. I'm just going to briefly say why, how, and what today. Next slide, please. So, what's our aim? It's to achieve equitable health for women and girls. And why? Because 51% of the population spend their lives in ill health, quarter of their lives more than men. And we heard earlier from Alice Mortlock about the health and wealth, and we know that closing the gap in health outcomes between men and women is expected to contribute to $1 trillion each year to the economy, and similar numbers are there in for the UK economy as well. We now have a renewed women's health strategy. We always had a women's health strategy, but it's really great that it's been brought to the forefront and particularly focusing on how that's embedded within the 10-year NHS plan. But what's also interesting is we are the only ARC with a dedicated women's health theme, which also shows that there's still a long way to go in terms of investment and focus needing in women's health. The Northeast ARC has got a theme, families, women, and children, but just focusing on women, we are the only ARC. And so we've got a lot of work to do in terms of contributing to research to address the priorities of the women's health strategy. Next slide, please. So these are our three sub-themes. The first one is across the life course of the woman, from adolescence to menopause and beyond, which means almost every single theme, unless they're working on a men-specific condition like prostate cancer. If you do have a population that includes women, then please get in touch with us because it's significant interest to us, health of women. The second one is pregnancy and childbirth, maternity safety, huge priority, and that's what we address. And last one is complex vulnerabilities faced by women, girls, as well as the workforce looking after women and girls in the NHS. Next slide, please. Sub-theme one, you will hear more from us this afternoon at 2:45. Please join us. I'd love to hear from you. So adolescence to menopause and beyond has got twin strands. The first one is women-specific conditions. This is reproductive health and sexual health. And the second one is conditions that affect women differently and disproportionately, or for which there are gaps in science, data, outcomes, women's views. Those are the two aspects that we focus in this sub-theme. Next slide, please. In the pregnancy and childbirth, absolute priority to enhance the maternity safety. We are focusing on the three shifts model, so moving from the hospital to community in providing tele-health care and antenatal as well as postnatal care. And lastly, how do we actually listen to women, optimize the experiences while they are under care for pregnancy, childbirth, and beyond? Next slide, please. And the last one is complex and intersectional vulnerabilities. Huge priority. We know there are massive gaps, not just between sex and gender, but also in terms of the regions where women live and work. There's a huge north-south divide. And we know that particularly if a woman is from an ethnic minority origin, as well as socioeconomically deprived and lives in the north, she's got the worst outcomes in the whole country. So it's really important that we take into account the intersectional vulnerabilities. So here we are focusing on three areas. One is complex households with multiple disadvantages. The second one is violence and trauma, be it physical or mental. And the last one is a cross-cutting initiative where we're looking at race equality for workforce looking after women and girls. Next slide, please. So these are our objectives for the first 2 years. And you'll hear more about it when you come this afternoon to our session. Next slide, please. So, where are we? We've now appointed two public contributor champions, and this doesn't preclude anyone from joining us. If you are interested, or if you know someone who's interested, please let us know, and we're keen to listen to your views as public advisors. We had our first stakeholder engagement. Over 80 people joined us on the 19th of March from a wide variety of organizations involved in the care of women and girls. It was a really good start and motivated us a lot to keep going. And we now have our sub-theme leads. The governance structure is established, and we are having regular meetings, and we'll keep you updated. Next slide, please. And that's the email of myself and Kirsty. I'm online, so happy to take questions in the chat box. Kirsty and Abby are there in person in Blackpool, and please feel free to catch up with them. Thank you very much.